because the root cause of disease oftentimes goes unaddressed, steroid therapy can become ineffective at masking the symptoms over time. And clients oftentimes end up saying, you know what, the prednisone doesn't work anymore. When in all actuality, it's not that the drug doesn't work anymore. It's that the animal has adapted to the drug and that the underlying condition has been allowed to progress and get worse to the point that the steroids are no longer effective. Now, before you attack your veterinarian for prescribing steroids, please recognize that our educational system and our training teaches us that this is what we're supposed to do when a patient comes in with inflammation. The conventional medical approach for both people and animals is to focus on treating symptoms rather than the underlying cause of the symptoms. So for instance, I was taught in veterinary school that the definition of an allergy is an immune system overreaction to environmental or dietary allergens. Got it. And we were also taught in veterinary school a variety of ways to manage allergies, including steroids. But a bigger question is, why is the immune system overreacting? Do we have a leaky gut situation or dysbiosis that is creating a hypersensitive patient? We aren't really taught in veterinary school how to tease out the answers, which are actually super important of determining why the patient has the symptoms. And believe it or not, it's not uncommon for owners to be totally unaware that their pets are even receiving steroids. Vets will oftentimes refer to these medications as anti-inflammatory shots or an allergy shot and not even say the word prednisone or steroid. If you don't realize that your pet is taking steroids, or if you're not knowledgeable about what they can do to the body, then you can end up being really surprised and actually heartbroken to learn that steroids have side effects that could be irreversible for your pet. So actually the ball is in your court as your pet's advocate to always ask your veterinarian what exactly is the name of the drug that you're prescribing and what are the side effects. Steroids are really cheap compared to digging for root causes. So sometimes pet parents end up having to use steroids because this is the cheapest, easiest way to manage symptoms and provide some relief. And in these situations, it's super important that owners are aware of the long list of side effects that come with using these drugs so that if the side effects begin showing themselves, they're able to taper their pets off. However, if you're a pet parent that has unknowingly been giving your pet steroids to cover up an underlying disease process, and this isn't what you intended to do, I do recommend that you talk to your veterinarian about creating an exit plan from these drugs, which requires a slow weaning process to avoid an adrenal crisis, especially if the animal's been on steroids for quite some time. You can't just stop cold turkey. Of course, my functional medicine approach is to identify root causes of disease, and that's quite different than what my conventional medicine training provided when it comes to what and why I would ever prescribe steroids to a patient. I absolutely have used steroids for stabilizing medical emergencies and to stabilize animals with acute disease. The difference is I don't stop there, and I would encourage you to do the same. When your dog or cat has a health problem, the goal should be to identify and treat the root cause while relieving symptoms, preferably with non-toxic therapies. This is when finding an integrative veterinarian becomes a necessity, either in person or via a phone consult. Natural alternatives to glucocorticoids do exist, but unfortunately, only certain integrative and functional medicine veterinarians who have continued their education past the 4 years of vet school are familiar with them. You see, most veterinary schools don't offer integrative medicine courses. We only are taught conventional pharmacological drugs in pharmacology. So until veterinary schools offer integrative courses, vets graduate not having a full toolbox of non-toxic therapies to offer you. So for example, when I graduated from vet school,